NCLEX RN Exam Questions and Answers 2026 to boost exam success. Question 1. A patient begins to have a tonic-clonic seizure. During the active phase, which of the following actions should the nurse take? Option A. Insert a padded tongue depressor. Option B. Prepare to use a bite block. Option C. Restrain the limbs gently. Option D. Turn the patient to a side-lying position and protect the head. The correct answer is option D. Turn the patient to a side-lying position and protect the head. Turning the patient to the side prevents aspiration, and protecting the head prevents physical trauma during the seizure. Question 2. After chest tube insertion for pneumothorax, a client develops hypotension, neck vein distension, and tracheal shift. What cause should the nurse check for? Option A. Infection of the lung. Option B. Kinked or obstructed chest tube. Option C. Excessive water in the water seal chamber. Option D. Excessive chest tube drainage. The correct answer is option B. Kinked or obstructed chest tube. A kinked chest tube prevents air from escaping the pleural space, leading to a buildup of pressure and tension pneumothorax. Question 3. A patient with a history of stroke starts choking on food but is coughing loudly and forcefully. What should the nurse do? Option A. Perform the abdominal thrust maneuver immediately. Option B. Perform back blows and chest thrusts. Option C. Exit the room to summon help. Option D. Stay with the patient and encourage him to keep coughing. The correct answer is option D. Stay with the patient and encourage him to keep coughing. If the patient is coughing forcefully, the airway is only partially obstructed. Encouraging coughing is the safest way to clear the object. Question 4. Which information would be most beneficial for the nurse to gather to tailor an individualized care plan for an 84-year-old with hypertension and mild cognitive impairment? Option A. General health overview of the last decade. Option B. Current health promotion activities like diet and exercise. Option C. Comprehensive family history of chronic diseases. Option D. The patient's marital status and living arrangements. The correct answer is option B. Current health promotion activities like diet and exercise. Knowing current habits allows the nurse to build on existing strengths and address specific deficits in the patient's daily routine. Question 5. To minimize the risk of aspiration during oral care for a comatose patient, what should the nurse do? Option A. Apply lemon glycerin swabs. Option B. Brush teeth while the patient is flat on her back. Option C. Position the patient in a side-lying position and lower the head of the bed. Option D. Use hydrogen peroxide to cleanse the mouth. The correct answer is option C. Position the patient in a side-lying position and lower the head of the bed. Side-lying position with the head lowered allows secretions to drain out of the mouth rather than into the trachea. Question 6. A dehydrated client with a change in mental status has a fever of 103 degrees Fahrenheit, yellow sputum, and pleuritic chest pain. The nurse suspects which condition? Option A. Adult respiratory distress syndrome, ARDS. Option B. Myocardial infarction, MI. Option C. Pneumonia. Option D. Tuberculosis. The correct answer is option C. Pneumonia. Fever, productive cough with yellow sputum, and pleuritic pain are classic indicators of pneumonia. Question 7. In a TB outbreak, which of these clients should the nurse prioritize for TB screening? Option A. 16-year-old with mild cough and fatigue. Option B. 33-year-old daycare worker with travel history. Option C. 43-year-old homeless man with alcohol use disorder, coughing up blood. Option D. A 54-year-old businessman with weight loss. The correct answer is option C. 43-year-old homeless man with alcohol use disorder, coughing up blood. Homelessness, substance use, and hemoptysis, coughing up blood, are high-risk indicators for active TB. Question 8. A patient has a positive MANTA test and night sweats. A chest X-ray is ordered. This diagnostic test is most crucial for which reason? Option A. To confirm the presence of active pulmonary tuberculosis. Option B. To determine if there is a need for a repeat MANTA test. Option C. To assess the size and spread of any lesions within the lung tissue. Option D. To differentiate between primary and latent TB. The correct answer is option C, to assess the size and spread of any lesions within the lung tissue. While sputum culture confirms the diagnosis, the X-ray is crucial to visualize the extent of lung involvement and the presence of cavities.